Okay, welcome again to this next session of our faculty development program. We appreciate your commitment to continuous learning and professional development. I'm honored to introduce today's distinguished speaker, Dr. Anuj Mubay. He is currently a distinguished fellow at the Center for Collaborative Studies in Mathematical Biology, Illinois State University, USA, and he serves as a senior fellow at the Kalam Institute of Health Technology, Visakhapatnam, supported by the Department of Biotechnology, Government of India. He holds adjunct faculty position at Sri Satya Sai Institute of Higher Learning, Uttaparthi, and Chitkara University, Rajpura. Previously, he held faculty position at the School of Human Evolution and Social Change, Arizona State University, USA, and served as a director at the Seaman Levin Mathematical Computational Modeling Science Center, USA. The broad areas of his research are applications of differential equation, nonlinear systems, mathematical epidemiology, mathematical biology, nonlinear dynamics, math biology, theoretical biology, modeling and simulation, and many more. Dr. Anuj Mubay, sir, has more than 15 years of teaching experience in applied mathematics, and they have published more than 118 papers extensively in top-tier journals. Today, Dr. Anuj Mubay will be sharing their insights on the module, current changes and future directions. Please join me in extending a warm welcome to Dr. Anuj Mubay, sir. We are grateful to have you with us today and look forward to your enlightening presentation. Welcome, sir.
Thank you very much. First of all, greetings to all of you. Good morning. And I'm not sure if so there are all the participants online, or there are some even in the classroom or somewhere physically present also.
No, they are online, but previous session ended just before 20 minutes. So they will be joining. In all, we have 68 participants comprising of research students who are in the budding stage, and assistant and associate professors also.
Sure. Thank you very much for inviting me. I don't know how we got connected, but I did got an email from Professor Neeta Shah, and that's how I'm here, and feel very honored to be part of your faculty development program, and try to draw some of my background from various sectors that I have worked on in the past. And I hope it will be interesting and for some way learning for the students here who are here in the presentation. So let me start my presentation, and then I will talk and discuss. And so the reason I asked about who is there in the talk is to basically know what is the background of everyone, and to what level they are from. I'm guessing they are all from mathematics, right?
Yes, sir. Yes, sir.
Okay. And they are also from varied skill level or school level, from undergraduate to graduate to maybe PhD students as well. So the thing I will be talking to you about is what is the role of dynamical system in healthcare sector. And the reason I want to discuss that thing is because many times we are in academia, we are not truly, I was a faculty at Arizona State, now at Illinois State, but and I have been part of industry as well. And I know the understanding outside the industry versus what exactly we do in the industry is quite different. I've written some article for SIAM News, Society of Industrial and Applied Mathematics, on this, understanding those differences. but again, it's really exciting to talk to you all about it right now. So I'll be talking about decision modeling that we do in healthcare sector, and most of these things in behind the scenes are dynamical systems. So so let me go. My focus outline will be really giving some background information about how I have been, I mean, what type of work I have been doing, what has been my trajectory, what exactly means by healthcare sector and modeling in healthcare sector. There are certain terminology that we use it. Um, and um, and then talk about examples from my research, and then conclude with where the future is going. I hope you will find it interesting. So if you go from counterclockwise, from India, I graduated from IIT Kanpur, and then moved for further studies to US, and did PhD in applied mathematics from Arizona State University, followed by some work with on substance abuse and use. Substance use and abuse is use of drugs, illicit drugs, not medical drugs, but illicit drugs. And how do you understand the spread of the drugs in the community, and what can you do as an intervention? So I was working with Prevention Research Center, Berkeley. Then I actually worked with a hospital chain, which is a semi-academic institute called as Cleveland Clinic. I worked in a department of infectious disease. Now, note one thing, the reason for me to show this thing is there are potential opportunity once you are graduated with an applied mathematics degree. So I worked with the Department of Infectious Disease in Cleveland Clinic, which is in Ohio State in US, and helped them with modeling of HIV. And then, I was working in a global health area at a Center for Global Health at Case Western Reserve University. Then I did a lot of work in the industry also, in a health economics field. It is a combination of economics, health, and modeling. Many and tools that we use from these three areas. And now I have an organization called as Kalam Experts, which is in India, and this is based in Government of India Biotechnology, Department of Biotechnology Park, which is in Visakhapatnam, and they are developing medical devices. So, so my trajectory has been in academia, in industry, and now I have my own organization. So I'm an entrepreneur. So there is a combination of experience that I have got in last 20 years. So this is an interesting information where I want to show why big tech fail in health sciences. So healthcare sector is not easy to work with. Why not? So let's see some examples, and that way you will get to know. For example, Google Health was a company by Google, and it was disbanded. It was in 2020. And the reason they worked for almost more than a decade, but Google is a tech company, by the way. And they have this company's sub company in Google called as Google Health, but they failed miserably and they disbanded. Now they have a new company called as Google Worley, and that is doing good because they have learned from this failure, Google Health, in the past. Apple also had a app which was a health habit app long time back, again 2 decades back, but they scaled back. It flopped. Why it flapped, why it did, I will talk in few minutes. But these are good examples that big tech are full of resources, one of the richest companies in the world, and still they failed in the healthcare sectors. The question was why? IBM has a Watson AI and data analytics platform that was sold off last year. Amazon and JP Morgan, they are big financial institution. JP Morgan Chase and Berkshire Hathaway. They had some organization named Heaven Health. That also closed. So the question that we were raising is why these big companies called as big tech failed in healthcare sectors, and what was the lagging in their process of running. So after analysis of their working characteristics and their use of data and their use of practices, it was suggested that they used small patient data almost 10 years back, and they based every new product from their company based on that small data sets. But the healthcare data is so fast, rapidly changing every day. And I will show you an examples of health data as we go along in the talk. Another problem that they found, there was missing domain expertise. They all were tech giants, and so all the employees were very good in technology, but healthcare sector, they have minimal experience. So they consulted some practitioner, but it was not an ongoing consultation, but it was one-time consultation in the very starting, and they used that consultation to generate this product. So the domain expertise in healthcare was missing. Also, they didn't even realize that how bad is the healthcare data. They called it dirty data, healthcare data. And why is that so? Because due to privacy issues, they are not supposed to share the data. One hospital cannot share the data with another hospital or anyone else. So they were making their own standards, their own way of collecting data, and therefore there were no standards between the data sets, and there was no connection between the data sets, and therefore and they did not realize that aspects of standardization would be a big issue. And that resulted in one of the failures. And then there is something called as, they did not even consider something called as a value of intervention. So this word, the value, is very important, and I will define this value in some sense in few minutes. Okay. Well, so the question is, we are here, dynamical systems. So the models that we work on is disease models, which are behind the scenes, they are dynamical systems. It could be individual-based dynamical system, or it could be population-based dynamical system, for example. So I want to give you some example where the results transform from the disease modeling work, disease dynamics modeling work, has drastically transformed the way we do things in a healthcare sector. So just to give you first example, in the vaccine for rotavirus is a childhood disease, a children disease, and there's a very high mortality in developing country for the children. And so in year 2000, when rotavirus came to the market, they were not using, they analyzed the data directly, and they said that it is not cost effective. It is not good to be given in the population, because either its cost is very high or its effectiveness is, its clinical use is very low. So one of the two is low, and therefore cost effectiveness is not good, and therefore rotavirus cannot come to the market. This was in year 2000. But 10 years down the line, in 2010, there is some expert use modeling now and showed, well, the same vaccine is now cost effective 10 years down. So there was a delay of 10 years just because they were not using disease dynamics models, effective models for evaluating that fact. So that showed really the features that disease models are key in bringing the true cost effectiveness of the product. Same thing has happened with diagnostic test, and also with screening or some kind of prevention methods. And the modeling work has showed over a period of time how good that treatment could be, or the interventions could be, as compared to not using the models. So this is some of the example that I dig from the literature, which shows the importance of the dynamical system in understanding it, provided you know the skills how to use it. That's also an important aspect. So here I'm assuming the skills have been, so modeling history has been almost 100 years. In fact, more than 100 years. 1600 is considered as John Grant as the first modeler who used smallpox data to show the mortality estimates for his model. But there has been patches in the history where the modeling work has been analyzed in more detail, and until the 20th century, there was not significant amount of work, but still there is more than 100 years of work for the modeling. And so modeling can provide quite a good understanding in healthcare sector. Okay, so what is health economics? Health economics is a field where I work, and that is where the dynamical system modeling is used now. So what is health economics? Health economics is a branch of economics or a branch of healthcare where we evaluate healthcare intervention. Intervention could be many, like vaccine, like drugs, like diagnostic test. It could be surgical procedure. So why do you need to evaluate it? Well, there is a reason for evaluation, because the resources are limited, and sometimes you have to make difficult choices. For example, when I'll give you an extreme example. When COVID was happening, there was flooded, hospital was flooded. So the new patient that were coming, how they were going to take the new patient. So sometimes they have to take a drastic decisions of not allowing certain patient and letting that patient die outside versus accepting the patients on a case-by-case basis. So they were evaluating, medical decisions were taking at that time based on the chances of survival. And that's a fact. Many hospitals saw that thing. That was the practical situations. We don't know because we were not in the healthcare setting. If any one of you were in healthcare or family member, they certainly know this fact that the decisions are very difficult choices, life and death situations sometimes. And the resources are very limited. So same resources has to be given. So who should you give the resources? So you need to evaluate it. And the evaluations are very important to do it. So this cartoon on the top shows that there are two choices. For example, there could be multiple choices. And one cost you are interested in comparing with the other choice. Suppose new drugs come to the market. So there might be an existing drug for the same disease. And so you want to compare, or you want to evaluate that drug with the existing drug. And so you need cost of that drug, and then you need an effect. Effect means what is the benefit you are getting for that drugs versus the other one. So there are two options, and you compare. Your evaluation means you're comparing one with the other. So is intervention A worth it compared to the other things we could do with the same resources? That's the goal of health economics. So when we evaluate, we take cost, we take consequences for drugs, for procedures, for service. And so the question that we are asking is, if you are using a drug A, will I going to have a gain or a loss in clinical outcome, in the clinical benefits? So, and also you are asking is, if I use a drug A as compared to the drug which is in the market, will I save or lose money? So those two statements are always taken into account in order to evaluate the new drug or new intervention in the market. So that is what health economics is. Now, why do we do that? Because without that evaluations, that will not be in the market. The government of the national government will not permit it to be in the government, because any drug would have a consequences and could lead to drastic consequences in patients. So for example, in England, there's a society called as National Institute of Health and Clinical Excellence. It is called NICE. That they ask for evaluation reports from the pharmaceutical company. So if that evaluation report is positive, then they allow that drug to come to the market. Otherwise, they don't allow it. In US, it is FDA, Food and Drug Administration. In India, it is still a doubtful thing. They do some kind of evaluation, but there is no rigorous evaluation yet to come. And that's a major issue in India. And it's a big market now because people don't do these health economics evaluation yet. And there are many studies in healthcare sector which says in India, or not in India in general, any developing country, it takes almost 8 to 10 years for any intervention in the developed country to come to the developing country. 8 to 10 years. So for example, antiretroviral therapy was a therapy for HIV. That treatment took 10 years to come to developing country like India. It was developed 10 years in 95, actually 92 in US, but it was not until 99 or maybe later that it was in the developing country. So it took many years for that new interventions who usually comes in the development. And so there is an health economic evaluation that is must for it to quickly come to the market and save the lives of many people. Okay. ICMR does, Indian Council of Medical Research in India, but they do it very simple evaluations, and this is very important now. So modeling questions arise from multiple health technology. So what is the health technology means? Health technology is vaccine, is drugs, therapeutics is drugs, is diagnostic test, is size of market for any device, medical device, or any drug. That also is health technology. And policy, making policy for health is also comes in the health technology. So these are all things. And using models, we try to understand the questions in each of these 5 categories. And there are different questions that we are addressing using dynamical systems. To whether the vaccine has an optimal to use in certain age group, for example. How much stockpile of the vaccine you should keep? Okay, could this diagnostic test reduce the incidence or the cost compared to the current diagnostic test in the market? So there are many questions like that that are addressed in this through these models and these models are dynamical system before it goes for economic evaluation by the national agencies. Okay, so in the few minutes back, I mentioned the word value of an intervention. The value is very important word. For example, if I see a car which is from 1960, someone will say that it is a junk because it's very old. Whereas some other person might say, oh my God, this car is it needs to be preserved. And it's an antique from 1960. So the value in the eyes of the second person is much higher for that same car as compared to the first person. So the question, the same thing comes for the drugs, for vaccine, for diagnostic test. Before it comes to the market, we talk about what is the value of this drug? What is the value of bringing to the market? So as I was saying, one person versus another person in terms of a car in 1960, the same thing happens in the healthcare sector where the different person is a different stakeholder. So who are the stakeholders? Stakeholders are government health departments. Stakeholder could be patient. Stakeholder could be hospitals. Stakeholder could be health insurance company. So the perspective of each one of them might be very different. They will say 1960 car is very good versus other might say, stakeholder might say 1960 car is not good at all. So the question of value is always with respect to the stakeholder. So for example, COVID vaccine, we undervalued COVID vaccine many times. And therefore, some of the vaccine didn't make up to the market. Why? Because they were undervalued. And what did they do? They were using models for dynamical system models behind the scene, but their vaccine, they were saying the vaccine are doing good things in saving lives because a person is not getting infected, but it's also reducing hospitalization. That is the value of it. But they fail to, many of these vaccine or models fail to incorporate economic normalcy. For example, when the vaccine came, we started going to our office. We started going to to our schools or universities. What is the cost or what is the value of those things were not incorporated in the models? So the complete value of the vaccine was not there and therefore undervalued by some modeler. So some of the vaccine didn't able to come to the market. Only some of the vaccine, some such as AstraZeneca vaccine, Pfizer vaccine, they were doing a good modeling studies. And therefore they did of course, their data was also good, their vaccine was also good, but then there was modeling was also an issue of some of the vaccine that didn't come up to the market. Okay, so the question is, how do you compute the value of the drug, of value of the vaccine, of the value of the surgery, of surgical procedure? How do you compute the value of the diagnostic test? How do you calculate the value of the policy, healthcare policy? For example, quarantine policy. So this is the formula used whenever in the healthcare sector we use a word value of something for some health product. So what is the value? Value is the ratio of benefits versus cost. Benefit versus cost. So the benefit is in the numerator, which is how good is the quality of that health technology or drug? What is the people's adherence to it? How many people will get access to it? This is all the benefit of that drug. And what is the clinical benefit that you are getting? Health outcomes is a clinical. So how patients is, if they take this pill, they will not suffer for 10 days. In 2 days, their symptoms will be resolved, for example. So they are saving 8 days of illness. So that's a health outcomes for the patients. So the quality and the health outcomes is in the numerator. And in the denominator is the cost. Cost to the treatment, cost to the transportation to the hospital to get the treatment, hospitalization cost. So direct cost, indirect cost related to that disease ailment. Okay, so that ratio is what considered as a value of a drug. Very important metric, and that is what is used in a healthcare sector too. Now, this value takes into account many different things. So it takes into account, for example, productivity. Productivity is, if I'm hospitalized, I cannot work, I cannot produce income. That is a loss in the income or a loss in the cost for the society. If I have a health insurance, I would be much relaxed, and therefore I will be, I will have a benefit of quickly getting access to the treatment. if I have health insurance. If we don't have a health insurance, we don't usually go to the doctor sometimes because it is cost money. So until unless it is emergency, we don't go typically. So sometimes this is in the US, actually, health insurance is very important. In India, we still depends on usage of. So there are many things that goes in the numerator and denominator of this formula. So when we talk about health economic evaluation, it's a decision problem. It's a decision problem. So there are two things. There is a new drug that is the pharmaceutical company is interested in bringing to the market. And there is already an existing drug in the market. So the question is, drug B, which is a new drug, and drug A, which is an existing drug. And you are comparing the value of this drug from one to another. Okay, so what you do is you calculate all the cost associated with drug A. Suppose a patient get infected and you give only drug A. And on the other hand, there's another patient get infected with whatever disease I'm talking about, and you give only drug B now. And the cost associated with all the cost and all the health outcomes related to that drugs and the treatment related to that. So those two things, you calculate it, and that ratio of the difference is considered as how good is the new drug as compared to the old drug. And this is called as incremental cost effectiveness ratio. That's the measurement. There's a metric that is used in the literature for making the analysis. And it is called as, this simple analysis is called as health economic evaluation. Now, in order to do that, you need to build a model. In this red compartment and orange compartment, there are models in which you are doing treatment A, and the disease is spreading in the population, and you are giving treatment A. In the orange compartment, you are also making a disease model, and that you are giving drug B now only, and so there is a disease models in these two boxes to evaluate. So there's a dynamical system in this decision model, and in fact, there is an optimization model in the very end which compare the two, drug A and drug B. Okay, but it's a simple framework, very, very simple idea. Okay. So, you know, I want to, you know, what do we do in healthcare? In healthcare, there are phases. There is a preclinical stage. Can you see my cursor, by the way? Can you see my cursor? Is it clear? Yes, okay. So
Yes,
there's
sir.
okay, thank you. There is a pre-phase. Pre-phase is a phase where you are not using patients. You are using animals, for examples. And then there are phases where you start using people for the drug, new drugs, that is. And then you submit a report after doing. So health economics evaluation is carried out at every stage. Many of the health economic evaluation is carried out. So this is a life cycle of the drugs. So drug starts with animal trials, then it starts with human trials, then it is submitted to the national body, the report of the economic evaluations, and national body says yes, or maybe not. It will come. So they evaluate it, but they have to do modeling work in all the phases before. And then approval happens. So then it goes to the market. And once it's in the market, you do different type of analysis, because now there are many drugs that you are comparing with each other. And that is called as a post-approval analysis, in which another type of modeling is needed. Okay, so there are three categories here. One, where you generate evidence. The first is determining the value. Second is evidence synthesis. That means you are analyzing the evidence and you to demonstrate the value. Here you use cost effectiveness model. Here you use early economic model. And then you use market model where you are the drug is in the market now. There are different type of market. You have to decide on its price. You have to design on which population will take, whether it will take given to the 6 years and younger, and many of these questions are there. Okay. And all these places, 3 places, we need models, dynamical system models. And every phase require a different type of models that we work with that. So anyway, so I'll skip that side. I already talked about it. I just, last week, I have this article published in Siam News. And here I talk about how do people do models in health economics type models. But I want to show very important aspect here. Different types of data, the gray color, the outside gray color boxes or ellipse are actually the data sets, different data sets that people use to analyze it. And in the middle is the model. Middle boxes is the model. So there are small models that goes in the big models to generate decision-making possibilities for a healthcare sectors. So I want to specify 2 different type of models. There is one called as public health models, and there is one called as health economics models. The role is very different for both of them. Public health models is for public health policies, for whether you should, whether we close down the business, whether everyone should wear mask in the common places. These are public health policies. Whether we give vaccine to everyone or not. Okay, that's a public health one. Health economics models are specific to the healthcare sector, which is disease, which is drug related, vaccine related, surgical procedure related, specific to the health technology, health intervention. Okay. So that is using economic models, and then there is a disease model. So what the type of data sets we are using is very, very different. So give you an example. For example, disease model, infectious disease modeling, for example, people use ecology data, epidemiological data, registry data. Whereas health economics models, we use insurance claims data, market data, social survey data. There's different data sets that one use. Okay, so and also before you build a model, you have to do some kind of mechanisms that goes in the model. What mechanisms were going? So that is done using statistical models, those mechanisms. So the role of statistical models are very important also here. So economic evaluation in healthcare, now the question is, how do you take decision? Which models to use? So this tree diagram helps a lot. So the question that we asked, the question we are asking is, what type of models one should use in healthcare? So the question we ask is interaction critical? The answer is yes or no. Interaction means human interaction. For example, diabetes. Is the interaction important? No, diabetes is not an infectious disease. COVID-19 interaction is important, right? So there are 2 different diseases, diabetes and COVID-19, which is COVID-19 interaction is important, but in diabetes interaction is not important. So no, so you basically decide on which of these models to use. So there are discrete event simulations. So and is it an individual based models that you are talking about? Does it require a lot of health states or only few states? So that questions leads to whether it is an individual based models, whether it is agent based model, whether it is Markov model, whether it is decision tree based models, whether it is system dynamics models. So these are the things are decided based on what I am interested in doing. It's not one size fit all. It is a different, the question drives us which model to use. Okay, This is giving a simple idea about whether we are talking about population, whether we are talking about individual, whether we are talking about interactions, and commonly used in healthcare sectors. These are the 5-6 important one, like differential equation, agent base, Markov models, and decision tree. These are the important ones that we use in the healthcare sector. So I will be talking to you about some of my research in few minutes, but I want to give you a flavor first. So I talked about two things first, effect and cost. Effect, what is the effect of a drug when it is given in the market? So effect means what? Is it reducing mortality, for example? Effect. Is it in making people to have better, reduce symptoms? Is it quickly recovering person? Is it reducing the hospitalization? These are clinical effect or clinical benefit. Okay, that goes in the numerator of the value. Okay, side effects, immunization rate, whether it is very comforting. Sometimes some drugs are given through the injections. Those are very discomfort. Some are with the pill. You just take the pill. So it is better to take a pill versus injections, for example. So that is a comfort level. That also goes in the effect or the outcomes of the drug. Okay, so this goes all in the numerator of the value. And denominator includes all the cost. So what are the costs? There are medical costs. There are indirect costs, such as if I'm not going to the hospital, I mean, if I'm ill, I'm not going to my work and I'm losing my income. So that is a loss to the society. So that's an indirect cost. Or transportation to the hospital is an indirect cost. Direct cost is cost to the doctor, cost to the medicine, cost to the diagnostic test. That's a direct cost related to that disease. Okay, so there are different types of cost that goes in that example. This is a list of many of these things cost. I don't want to waste times in that. I want to give you actually this part. So in modeling, in healthcare sector, we use lots of healthcare data. So I want to give you some example of a healthcare data. So clinical data, when we go to the clinic or hospitals, they ask my name, they ask my age, they ask my previous medical history. Many questions they ask. Whether I have taken any diagnostic test, whether I have taken any pathological test. All these things goes in a clinical data. Okay. Then comes a medication. When we get a prescription, we go to the pharmacy. That's a prescription data or medication data. We get it from pharmacy store. Health insurance data. Some people have health insurance. Maybe in India, less people, but they do have that health insurance data. That is called as a claims data. That's the third data. Molecular profiling. Sometimes we do genetic testing. For cancer, there are lots of testing that happens. For other diseases also. That is a molecular profile. Family history data now we are using. Mobile health. For example, we are using wristwatch to track of our sleep cycle, of heart beats. Those are mobile health. Environmental data. For example, pollution in my community. Right? Amount of number of cases in my infection load in my community. Climatic factors. These are environmental. Patient reported. Patients sometimes do the social surveys. That data. Social media also we use, like Twitter, like blogs. We are using that data now. Literature data, of course, literature we use quite a lot. So these are all data nowadays we are using to parameterize the models, dynamical system models that we are using. Okay. So we use different softwares like Visual Basic, VBA in Microsoft Excel. In practical field, what they are using people. Of course, there are many languages, but they want to do things quickly. And what are the tools that are there is proprietary software called as 3H Pro. There's MATLAB, there's R that people, and each one of them has pros and cons. And I don't want to go into that, but I want to show you, we cannot say, if we want to work for a practical problem, we cannot say, oh, I learned R in my PhD, and therefore I will be using the same software. No, we have to quickly learn it and use the right software, which is appropriate for modeling to address the right questions, basically. So I want to go to my research example. So this is one example that was from one of the pharmaceutical company, and they came out with a diagnostic test for COVID-19. And this diagnostic test is on the top right corner. It's like a chip. You basically put a drop of blood and it tells you the result, whether you have the infection or not, in 30 minutes. It's called as a rapid molecular test. RMT. It is used a lot in COVID times. Now, the question that we were addressing is, this test was about to come to the market. The existing test was PCR test, which was taking 4-5 days. So this is 30 minutes, and that was taking 4-5 days. Which one you will take? You will say 30 minutes. No, not that easy. Because this 30-minute test has a lot of incorrect results. Whereas PCR is a very thorough test and it doesn't have that much of error. So there's a balance. There's less time but have error. There's more time PCR test, but has less error. So there's a trade-off. Less time makes you know your result very quickly. In PCR test, you are getting 2-3 days to get the results. Note one thing, in 2-3 days, you are waiting for the test result to come. You are in the market, you are everywhere, and you are infecting other people. So you are generating more cost to the society by infecting other people. So there's a trade-off that you have to understand. So the question that we were addressing is, this fast rapid molecular test, is it cost effective? It has an economic value as compared to the PCR test. That was a basic thing. And it turns out that if the PCR test is taking more than 2 days for the test result to come, then this rapid molecular test is very good to use in the population. But if it is taking less than 2 days PCR test, why was PCR taking so many days? Well, there were so many people lining up for diagnostic tests during COVID times. Okay, so this is the trade-off that we were doing. The question was, what model you were using? Well, we were using model called as decision trees. And decision tree were basically, there were 2 decisions we were making. One was rapid molecular test, and then one was this PCR, clinical central laboratory test. So basically, you take a test and whether the result is positive or not positive, but there's a probability of being a positive or not. In rapid molecular test, which is this one, the test results are more likely to have errors, and this have less likely to occur. But just, I want to give you a flavor. I don't want to go into details, but just want to give you a flavor. So the conclusion was, rapid molecular test was much more cheaper for using it than a PCR test. Okay, it was almost twice the cost. Cost per patient tested. Per patient tested. So $375 versus $630 per. So there was a dramatic. So the cheaper one, we will take it. Per patient tested. So we will take the lower cost was better to use. Now, there was another study that I was part of that was about hepatitis C in the US. So the government was interested in knowing if I increase the hepatitis C treatments to other population. So hepatitis C is a disease that is infectious disease, and usually it is transferred by transfusion or a blood transfusion, or using of injection, which are used in one patient and then used in other. So many drug users get this hepatitis C, or in the hospital setting, sometime infected drug is transferred to the patients, and therefore people get infection. So it is the infectious disease, but the question was, could we expand using it to the drug user, the people who use injection drugs, because injection drug is another way of transmitting this infection. And so the question was, if the treatment is given to all the infection drug users, and what would be the benefit of that? So we use this dynamical system model, we use economic models, and then we do a cost effectiveness models that compare the benefit and the cost for extending the model to the other stage. Now, note one thing is, typically this is in hepatitis C, there are 5 stages of fibrosis, and it is typically given to the last stage of the patient, F4. It is called F4. These are the stages, F0, F1, F2, F3. These are called fibrosis stages. And it is typically given to the treatment in F4. The question that we were trying to address, what if we start giving it to F1, F2, F3 treatment also? And what benefit you will get in giving it to the previous stages of hepatitis? It will cost a lot of money, right? So the question that was how we can reduce the cost, and is it cost effective or not? Well, think about that. If you give it in a previous stage, you are increasing the number of patients, so you are increasing the cost. But what is the benefit? The benefit is now these people are recovering and therefore not infecting other people. So there is a benefit also for giving it earlier. So there is a loss of increasing the cost, but there is a benefit about reducing the infection. So there's a trade-off again, and it turns out if you do that extension to the other stages, it is very cost effective in a 20 years time span. There is a sickle cell disease, which is in the patients of is a very young age patients, and the patients have strokes, some light strokes in their life, children, and these children basically have problems later on because of the stroke. Their life is not same as a normal kid. So they because of the stroke, their mind abilities starts to decrease, their other things starts to affect everything, the salary, the education, everything in the daily life get impacted, and they actually don't survive very long. But sickle cell disease is actually common disease, and the company that we were working on, they bring some medicine, and that medicine is used to improve the condition related to sickle cell disease. Basically, the sickle cell disease treatment improves some of the biomarkers which make the patients have less strokes and therefore have a better life. Okay, but it costs more money also. So here we were using many different type of dynamical systems. We were using pharmacokinetics and pharmacodynamics models for the biomarkers inside the body, because that treatment was working and affecting the biomarkers. We were using climate model, catastrophic models to understand strokes. Strokes can happen as a disturbance in their life. So that was catastrophic models is the same thing as we use in climate models to capture hurricane catastrophic events, hurricanes, tornado, tsunami, and all those things. So we used catastrophic models to study their stroke events, and then linking their social behaviors with their cognitive abilities through the statistical models. And then eventually we use economic models, dynamical economic models, to capture their economic aspects, their earnings, their salary over a period of time. So there's very sequence of models that was used to study something like that, sickle cell disease. In another still, we were studying pandemic in Florida. And in pandemic is COVID-19 basically. And we were using a modeling technique called as digital twins. Basically in the office space, in the malls, in the university campuses, they were using CCTV camera and imitating how people behave in that and using that data to capture the modeling aspects on top of it. And that is called as digital twins. That means you are capturing as it is using digital images or digital footprints and defining a model on top of it to study COVID-19 here. So these are the pictures from these models. These are in the form of dashboards. And I'm involved with one which is using for state of Florida and also for Center for Disease Control. Right one is from Center for Disease Control and left one is for state of Florida. And we were using the models, digital twins behind the scenes to capture. And dashboard is very, very important to project the visualization aspects of our results. Okay. So I think I have another few minutes, so I will conclude here very quickly. I want to bring the artificial intelligence role in our work. But before I go into artificial, I'm not taking it just because artificial intelligence is a hot topic nowadays. It's not that is the reason. I'm talking about it because how we are using in the healthcare sector. So before I go into explaining how we are using in the healthcare sector, I want to give you some idea here. So there are many terminology people use: artificial intelligence, they use machine learning, they use deep learning, they use generative AI. Okay, and these boxes are the subset of, one is a subset of another, the way I have defined, shown the picture. It has a very long history. 1950. Was the first time the concept of artificial intelligence was start to originate. And machine learning start to pick up in 1980s, whereas 2010 onwards, deep learning start to come, and 2015 and 20 starts to come generative AI. So what is the difference in that? So artificial intelligence, AI, is we do not involve learning from the data. It is certain rules that we tell, and it does the same thing. For example, we code something and we tell an agent-based model, we code it. And that code is an artificial intelligence model because we have given a set of rules on which it will run every time I will execute that program. So that is an artificial example of it. Do not involve learning from the data. Again and again learning. It's a fixed data and that's it. Okay. Machine learning is based on the data. It learns from the data and from the past data, and it suggests something. For example, it tells you my behavior I have done in the past. I bought a certain pair of shoes. So it will suggest me that pair of shoes again and again. So that's called as an ML model. Deep learning is also uses data, but now uses a large amount of data that comes from images, speech, and make a complex decisions. It's going deep into the learning from the data. So the first category is not necessarily using data for learning. Machine learning and deep learning is using the data, but deep learning is using a large data sets, whereas to train the models. And then the third last aspects is a generative AI, which means that you are creating a new content. It is learning from the large data, but then it is creating a new idea. That is a generative idea. So it is behaving like truly like a human. Okay, so that's the terminology people have been using in the past in this thing. And the reason I want to tell you is very important reason. So the question comes, why AI technology is advancing now? I will answer these aspects, and then I will show how artificial intelligence are incorporated into the dynamical systems models nowadays in the healthcare sector. So why is AI becoming so famous nowadays? Well, many reasons. It has a long history, 1950, but not until recently, the high performance computing or graphics starts to evolve recently. And it is needed to show the results of artificial intelligence. Second is machine learning models or deep learning have now become more sophisticated. And therefore, and the third is there is lots of data now is available. Because of the cloud computing, we can access that data also. So there's lots of data now available. And therefore, all these three things are joining things together in order for this AI tools to become famous now. This is the right time now to famous. And it has not happened in the last 50, 60 years. Okay. So this is the, future decision modeling with AI is very important, but intelligently. How we use AI is very important. So let me show you where we are using AI nowadays in healthcare sectors. So we are using in generating research questions. We are not asking it to generate a question for us, but we are using it as a discussion tool. So we give some terminology and we ask what is the appropriate research question, and then we, from our mind, we read papers and we compare, and because it is using large amount of data, but you don't know whether that is an accurate data, it is giving a some logical understanding, which we compare with our understanding and we make a research question. That's where it is using. It is helping in quickly time saving in reviewing a scientific literature. So it is helping. Now we don't know whether it is correct or not, whether everything is correct or not, but we are using it as a validation for our work for searching the literature. We search literature all the time for estimating parameter, for validating models, for doing sensitivity analysis. All these things requires literature reviews. Okay, so that is what. Also, sometimes there are new data sets that are evolving. For example, in one of the project, we are using location-based services, that is mobile app. You know, all these app that we use, there's some companies which is collecting a data from an app. How do you use it? So that is, it is helping us to know exactly what are the data we can use. But remember, we cannot cite any reference through the data sets. And of course, validation. I think the time is up. I want to just end with this particular slide where the time is up, right, Dr. Shah, I think for me?
No, sir, you have 20 minutes more if you want.
Oh, okay,
It is
cool.
12:08.
Okay, fine. Okay, so the, the question now comes, what are the skill set that is required? A skill set is not the same when I graduated from my PhD. It is not same, which was almost 20 years ago. So it is not the same skill set that is then important. So traditionally, what was important? The left side is a traditional, orange box is a traditional. So that traditionally we were supposed to know how to do literature review. We were supposed to know how to develop a research question, a storytelling of our work. We were supposed to write scientifically documents. Okay, we were supposed to use develop models for represent a real world phenomena. That was traditional. Now that model could be statistical model, it could be dynamical model, it could be optimization model, different types of models. But we were supposed to know this process. We were supposed to know first principle from which the mathematical models can be generated, or techniques to analyze, maybe bifurcation analysis, maybe singular perturbation analysis. We were supposed to know these principles. We were supposed to know numerical schemes, how to simulate the models, right? We were supposed to know software packages that were key. So nowadays, these are traditional skills. These are changed. Traditional skills are also important, but in the era of AIs, the new set of skills are now becoming very important. So what are those new skills? That is in the green box on the right-hand side in my slide. The new skills are content generations. How do you search ChatGPT of a content? For example, I need a simple model, SIR type model for understanding COVID outbreak in New Delhi. So it will generate a simple model. So writing an appropriate question that will generate a content that is there in your mind is what is the new skill set. Okay. How do you generate a high quality written document? You were taking probably 1 month to revise papers. Now it can help it very fast by editing it very quickly. Okay. AI literacy is very important. We need to know AI. If we don't know, it's like in 20th century, the important literacy was read, review, write. But now AI literacy is very important. AI literacy means you have to know the techniques which are used in machine learning. Whether or not you are an expert in it, that is not important, but you have to know. Literate. You have to be literate. So you need to know what are the practices, best practices in use of AIs. You have to know how to do simulated experiment using AI tools. This is called as AI literacy. Okay. Also, third thing, which is very important, is ethical use of it. We have to know when the information is biased or broken information. We can't just use it from the AI without understanding that. Will it going to harm anything that I will use from AI and put it on my paper and someone would get harmed? That has happened many times in the past. So we need to know ethical consideration of the use of AIs. Okay, so there are also, we need to abreast ourselves. We need to make ourselves up to date on the latest development, research, best practices in AI technology. And they are changing very rapidly. We need to read on these things. It is changing so rapidly, we don't know. The last month information is obsolete nowadays in the field of AI. So the modeling roles are everywhere is a content generation. You need to get, okay, what are the mechanisms that will go in my model? That you need to generate using keyword, content generate using AI tools. You have to find out what are the estimates of the model, inputs, estimates of the parameters. Where will I search? What is the data? What type of population? That would tell AI, right? So these are the things models are using every day. Okay. And where is the healthcare going? Future healthcare is going. So I talk about future of modeling in the era of AI in the previous slide. Now I will talk about future of healthcare, because if we want to work in a modeling on a healthcare, we need to know where is an application field going. The domain expertise are must now. This is a new level of skill set. If we want to work in finance field, we have to know the terminology or the language of finance. If we want to work in a retail sector, we want to know the terminology of the retail sector. 10, 20 years ago, we didn't need that skill set. At least many of us didn't have that skill set. Now it is important, domain expertise. So in healthcare, how is the technology changing? I want to give you a few examples here. So right now, there is no that this company is a healthcare sector and this company is a different sector. They are all mixed up because artificial intelligence, because digital technology is there, because of internet is there, they are all mixed up. Now technology companies which used to make softwares and which used to make computer hardwares is now actually becomes a health technology company, a healthcare company, such as Google is a health. It used to be a technology company, not anymore. It is a healthcare company now. Apple is a healthcare company. They have wearable now. They are selling their healthcare data. They are slowly and slowly encroaching towards the healthcare. Google is also having Worley. Worley is a very famous Google brand. So there are many. Retail sector is also coming in the healthcare. Okay. So that is one change. Another change is happening is the way things are evolving. For example, there is a new test that has come to the market for in the cancer in oncology field. It is called Galleri. Galleri test is a blood test. A drop of blood can tell you 50 different type of cancer early on in your life. Typically, what happens, one get detected for cancer due to some other reasoning. When they go for a hospital for some symptoms, they identify, oh, this person has that cancer. Now, this blood test is not only detecting 50 different type of cancer, it is actually detecting very early on in the life of a person by just a blood cycle. So you would say, oh, that is a good medical advancement. Yes, it is a good medical advancement, but there is a problem. The problem is now you are making people more anxious because cancer is a deadly disease. Now, suppose you take a blood test of someone 10 years before actually the person shows the symptoms, and you are telling that person you will have one of the cancer 10 years down the line in your life, that person is anxious now. There is no treatment for 10 years in advancement. Until you have a symptoms, no treatment is available. So the only thing a patient has is an anxiety in the life. And therefore, there's lots of challenges with this type of test coming to the market. There's another test, genetic test. Same issue. You take a gene and you can tell many diseases the person can have in future. And so now the question comes, after being diagnosed, yes, 10 years, 20 years down the line, a person will have that disease because your gene is showing certain disease features. That means what models to use to study which treatment to give. Nobody knows. These are open questions. And modeling can help in doing permutation combination of understanding dynamical system in both the cases. And some groups are actually started to work on that directions. Now, social media up till now was more Facebook, Twitter, up till now was used as a social aspect, not anymore. There are governments, there are clinics that are putting their handles to empower patient with the informations. What to do in the case of infectious disease, what to do if you have symptoms. They are giving information to the patient, but they are also taking information from the patients. Patients write, oh, I have the symptoms after eating this thing. So that gives me characteristics from people who are openly giving the data without any biases in that. So there is now the question of there are extended data sources now. How do you use these data sources in our models? That is the challenge in medical field. There are more rare diseases because of these genetic testing, because of these sophisticated medical technologies now, more and more rare diseases, rare disease means which happens to very few people, but it happens due to mutations of the genes, for example. There are 7,000 of them which are known, and only 5% have a drug. 5% out of 7,000 diseases have drugs. One of the disease is called spinal muscular atrophy, in which the baby is born with no muscle power. The muscle is very weak. The child cannot sit properly, cannot stand properly. Muscles is very weak. That child typically in the past have died because no muscle power, lots of problems, someone always caregiver needed, and it is not possible to there was no treatment. Recently in 2022, there's a drug that came for spinal muscular atrophy, and the drug is called Zolexma. The drug cost $2.1 million. $2.1 million for one treatment. But this can literally cure this disease. But there's lots of modeling questions. How do they come out with this cost? What is the value of this drug? Is 2.1 million is an appropriate cost of the drug or not? Actually, it's in the market. So someone has brought a model, they have evaluated the value of this drug, and the national health agency has approved this drug. So $2.1 million for one treatment is a good price for that rare disease. So, so the question that is evolving now is more data that is coming from many patients now. Is the 2.1 million can be reduced, and reduce how? So there are lots of modeling challenges that we asked. So I want to end with this, sustainable development goal, which was started in 2015. There were many of them, sustainable goals. They also talk about this report of United Nations, which initiated in 2015, that it says 20th century skill set was very different than a 21st century skill set. In 20th century, RRR was the main goal: reading, writing, and arithmetic, and mastery in the core subjects. But not anymore. In 21st century, AI literacy is important, critical thinking is important, storytelling is important. These things needs to be in our curriculum system. Global mindset, how things are evolving in the global mindsets, that is very important. And we have to learn the other domain also. Some idea about other domains. Suppose if you are a mathematician and wants to work in a healthcare sector, you have to know terminology or the way people are studying, modeling in a healthcare sector. Sufficient information, domain expertise, it is called. So things have drastically changed from the last decade to this decade. And the new skill set that is, and UN has already highlighted it in 2015 in the Sustainable Development Goal. I will stop here. Thank you very much for having me and giving me time to discuss things. I hope it is interesting and learning experience for you.
Yes, sir. It was really interesting. In fact, it has given a good number of problems in health sectors to be addressed.
Yeah.
Using AI scenario.
Right. Right.
Any questions, participants?
And of course, you are welcome to send me email or follow me on I'm LinkedIn. I'm very active on LinkedIn. I write articles on it on a regular basis. I'm writing for SIAM, I'm a regular writer for SIAM. So LinkedIn is something, Twitter also, that I am on Twitter as well. So feel free to, I'm sorry, let me show you one more time so that you guys know where to look for. So if you search my full name, you will be able to find it on social media. But also happy to take questions later on also. It doesn't have to be right away, but happy to address any questions if you have.
Sir?
Yes, sir. Thank you. Thank you, sir, for such an insightful and engaging presentation. Your expertise on healthcare area has provided us with valuable knowledge and practical strategies that we can apply in our professional practices also.
You're welcome. Thank you.
At this last session gives more information about what mathematician can do. What is their role in the sustainable society, not only in terms of diseases, but many more.
So,
thank you, sir.
Yeah, you're welcome. Yeah, and the more if I don't know if you are having a SIAM newsletter that comes to your department, it is important that if we are interested in dynamical systems uses in other fields, SIAM newsletter is a best source, because every week, every fortnight, I think they have a newsletter, and that newsletter has applications, people writing about different fields, and they are writing in a layman's terms. It's a very simple way of writing, no sophisticated. Some are sophisticated article, but most of them are not, and so it is quite easy to understand. And so follow that one, and if we can get online subscription of SIAM newsletter, that would really help in your students, by the way. So I think, Professor, you are muted.
Yeah. I'm sorry. So participants, let's thank Dr. Anuj and all resource persons. So we will have vote of thanks by Dr. Akash Singh. Sir, 5 minutes more, and then you can go to sleep.
Sure.
Yes, as we come to the close of this enriching faculty development program on exploring research frontiers in dynamical systems, organized by Department of Mathematics jointly with School of Emerging Science and Technology, Gujarat University, I am filled with immense gratitude and a sense of accomplishment. It has been a truly insightful and productive experience. First and the foremost, I would like to extend my heartfelt thanks to our organizing committee. Without their tireless efforts and meticulous planning, this program would not have been possible. Special thanks to Professor Nita Shah and the team for their dedication and seamless execution. Our sincere gratitude goes to our distinguished resource persons on the sessions on mathematical modeling have been incredibly informative and inspiring. Your willingness to share your knowledge and expertise has greatly enriched our understanding and provided us with valuable tools to enhance our professional practices. To our dear participants, thank you for your active participation and engagement throughout the program. Your enthusiasm and willingness to learn and share have made this program truly interactive and successful. We appreciate your insightful questions, discussions, and feedback. But again, keep patience. For the FDP certificate, the fee receipt and the recorded videos of the sessions will be given to you through your respective email. We must also acknowledge the invaluable support of our technical team and administrative staff. Their behind the scene efforts ensure that everything runs smoothly from the setup to the technical support and beyond. A special thanks to organizing secretary Jalpa Waghela for her dedication and hard work.
Thank you, sir.
In conclusion, this faculty development program has provided us with new perceptive skills and connections. I encourage each of you to apply the knowledge and insight gained here in your respective roles and to stay connected as we can continue to grow and learn together. Thank you once again to everyone who made this program a success.
Sir, I have one question. Can I ask right now?
Yes, sir.
Sir, I would like to ask, what is the future of healthcare system in India, in industrial? I'm not talking about academic possibility. I'm asking about industrial possibility in India.
I am guessing that this is addressed to me.
Yes, sir.
No,
Yes, sir.
it is addressed, but with respect to the US system, not Indian system.
Okay, so let me take a response, and then maybe others can also join in terms of a response. So may I know what is your background first?
I have completed my MSc and I would like to pursue a career in PhD in mathematical biology and modeling.
Okay, and master's in what?
MSc in mathematics.
In mathematics. Okay. Well, there is a huge prospects in India right now. Many pharmaceutical companies are hiring people who have a mathematics backgrounds. They want to do few things. They want to know that you have an understanding of Markov type models. You have an understanding of how to do literature review. You have understanding of the statistical models also, and you know how to use AI to speed up the process, right? That is something that is nowadays not only pharmaceutical companies but also the consulting company. I don't know if you know consulting in healthcare. There are many consulting in healthcare companies, and for example, Optum, for example, IQVIA. These are very famous companies in healthcare sectors. Also, one of the field which is extremely going, Government of India has established six medical device zones. These zones are the national is the park, like a technology park used to be in Noida or Gurgaon or Bangalore. Now it is a medical device park where they are hiring mathematicians, also quantitative people who have these skill set. So I've told you two things. What are the places where people are hiring with a mathematics background? And second, what are the skill set that is needed to qualify the interview?
Okay, thank you, sir.
So AB, you will have to show your potentiality in other skills with mathematical background. Okay, so thank you, sir. And thank you, participants. Participants will have to fill up the feedback form. Then only they will get certificate and fee receipt via Google Drive. But do keep patience. We are busy with admissions, so it will take at least 10 days to have in your inbox. Thank you, sir.
Thank you. Namaskar. Dr. Shah, you have done amazing job in informing, keeping me in loop. This is the first conference, I must say, that you were on top of everything. So thank you for being, I wanted to tell you specifically on that, that you regularly messaged and make sure that I had the information that I needed from time to time.
Thank you. Thank
So,
you.
yeah.
Okay. Bye-bye,
Bye.
everybody. We are closing the meeting.